Good morning, good afternoon, good evening, whichever place you are in. We are happy to have you yet for another session, a wonderful session today. And we are having the degraded air quality, which is very, very interesting, as well as, the past sessions that we have had. And so I want to take this time to welcome all of you into this wonderful meeting and wonderful course of the Africa Climate and Health Responder course. And so just to remind you a little bit is that we are actually translating every session. There's going to be a simultaneous translation, and we have different languages, including English, French, and Portuguese. You can be able to use the button that has been cycled down in my slide. If you are using Zoom, you will definitely see the interpretation button below the Zoom. And so you can be able to select the language of preference. And today's session will be focusing on degraded air quality, and every Tuesday and every Thursday until October 22nd, we'll be having different sessions. Next week, we will also, not next week, but on Thursday, we will be having another session on vector-borne and zoonotic diseases. And so we want to welcome you to continue being with us. And a little bit of the logistics that we are having here. We are going to have a 90-minute session, but I have to remind you, one of the presenter will the first presenter will present, and then we'll give, a small session for the presenter to answer some of the questions before we can be able to go to another session altogether. And so we hope to finish on time. And I hope that we are going to be engaged in all the sessions that we are having. And then after that, we are going to have the case study presenter presenting before also engaging in the question session. And so the session will end with the question and answer sessions again. And you can be able to be sure you enter your questions in the Q&A button. You can be able to see it in your computer in the Zoom, so that you can be able not to miss it out. And the session videos, we are also reminding you, will be recorded, and the slide decks and resources will be made available on the course website. The other thing that you need to know that today our learning objective is very, very interesting, because we want to describe the pathways through which climate change affect ozone, PM 2.5, occurrence of wildfire, desert dust, among others that are there, and how these pollutants eventually impact climate sensitive respiratory diseases such as, asthma, among other diseases, and even cardiovascular diseases that are there. And we are also going to identify, populations that are vulnerable to the degraded air quality. And so this is a very good session for you to be able to know populations that can be easily affected by the degraded air quality. And we also going to describe public health measures to protect, vulnerable populations, as well as, describe the near-term health or core benefits that arise because of climate mitigation at different levels altogether. And so this is a session you don't want to miss, and it's very interesting and engaging. The presenter that we have today is Dr. Kofi. Dr. Kofi Amega is an associate professor of environmental and nutrition epidemiology in the Department of Biomedical Science, University of Cape Coast in Ghana, and he leads the Breath Accra project that is funded by Clean Air Funds, which seeks to accelerate air quality improvement in the Greater Accra metropolitan area to protect public health and help inspire greater action on air pollution in other African cities. He is also a member of International Society for Environmental Epidemiology and the Nutrition Society in the UK. And he's also a founder member of Africa Air Network, as well as a collaborator on the global burden of disease studies. So we have Dr. Kofi, who is also someone who has participated in the World Health Organization expert meetings of the global platform on air quality and health. And we will be having several discussions right now with him. The other presenter that is before your screen is Azeza Rangunwala, sorry for that, Azeza Rangunwala. And Azeza is a medical scientist working, you know, at the nexus of climate change and health in the environmental justice space. She is currently, you know, the African Regional Coordinator of the Global Green Healthy Hospital Program, and as a Senior Campaign Manager at Groundwork, the African Strategies Partner of the Healthcare Without Harm. She works to transform the health sector towards, you know, decarbonized and climate resilience healthcare. Azeza is also a researcher in different capacities and assistant director and policy and capacity building, you know, expert who is doing quite an amazing job in Africa. These are the presenters that we have today, and we hope that we are going to enjoy, you know, and also learn from the two presenters whom we are having today. And just before Professor Kofi comes in, I also want to thank you so much for participating in this. And remember that a link will be shared on the chat so that you can be able to give your opinion. Please make sure you get the link in the chat so that you can, or you can be able to scan the QR code and give your opinion on the trainings that we are having. And remember to also, you know, join the WhatsApp group and check on the updates that are always being given. Up to this point, I want to welcome Professor Kofi. Professor Kofi, it's your time, and you can be able to share your screen so that we can be able to know what you are talking about today. Professor Kofi?
Yeah, Patrick, thanks for the kind introduction. I believe everyone can see my screen. Patrick,
yes, we can see your screen. Okay. Yes, thank you so much.
So, Patrick, I thank you for the kind introduction. Let me also thank the organizers for the opportunity to give this lecture on degraded air quality in African cities. So there are some learning outcomes that I think we can start with. So, and that has guided the development of my slides. So the first one is for us to understand the pathways through which climate change affects pollutants. We also need to understand how air pollutants impact climate-sensitive respiratory and cardiovascular and allergic diseases. We also want to identify populations that are vulnerable to degraded air quality. We want to know the public health measures for protecting vulnerable populations. And finally, we want to appreciate the health co-benefits from climate mitigation at individual, local, and global scales. So air pollution is a big problem in sub-Saharan Africa. So somewhere in 2016, myself and my colleague at the University of Ghana, we put together this piece. And interestingly, it's still relevant today. In this piece, we started to identify the pollution problems, the drivers, and also importantly, some of the steps that can be taken to address the air pollution problems. But then, not only addressing the air pollution problems, but how these proposed actions or mechanisms can also help us meet the sustainable development goals that embodies air pollution or air quality. Just recently, the State of Global Air report was released, and the narrative for Africa is the same. The story hasn't changed. You realize that you look at North America, Oceania, and you realize those places are clean. Look at sub-Saharan Africa, and then you realize that we are in deep problems. Air pollution levels are greater than 28 microgram per meter cube, 40 to 50 microgram per meter cube. And this is way above the WHO threshold of 5 or 15, depending on where you want to place the line. But the question here is that usually I have a problem with this map. The problem I have with this map is that we have very limited ground monitoring installation in Africa. In most African cities you go, they don't even have a reference monitor. You're lucky to find one. So where are these estimates generating from? These estimates are generating from satellite data. And I'll come to satellite data and let you know the reason why I have a problem with this map. Because there's a lot of limitations associated with satellite-derived PM 2.5 data. But in an environment where we do not have data, this is fine. So this is the story of sub-Saharan Africa as we speak. Again, in sub-Saharan Africa and many developing regions of the world, there is something we call household air pollution. And that is also a big problem in sub-Saharan Africa. This is because we are using charcoal and wood for cooking. So you have about 75% plus of the population using charcoal and wood for cooking and heating. And this generates a lot of pollution in the household, which can also get into the ambient environment. So what I want to indicate here is that the household air pollution as a result of solid fuel use is also one of the major contributors of ambient air pollution. And again, you look at sub-Saharan Africa, this is where we are using the solid fuels mostly. You know, I talked about the lack of data, the limited ground monitoring installation in Africa, and its attendant lack of data. So this was a report that was produced recently, and this report tried to indicate locations of settlement with data on PM 2.5. And I don't need to talk much. You can see that Africa is bereft of air pollution data. From this map clearly, you can see. So there's an over-concentration or saturation of these monitoring installation or data in North America and even in Asia. You can see it there. But in Africa, we have problems as usual. The same story holds for NO2. And even for NO2, the situation is even there because I only see just one monitor in South Africa from the map that I have projected. This is also a recent report or publication from WHO. And WHO has a database which is called a WHO Air Quality Database. And unfortunately, this database is not about satellite data. It's about locations where they have ground monitors. And this is where WHO collects that information from air pollution or air quality and then embed them in their database. So if you look at this recent publication from WHO Table 1, then you realize that in Africa, number of countries that has recently been included in the database is just 4. Compare that to Europe, 10. So you could see that there is a growing trend in other regions, but Africa has become very stagnant. If you look at figure 1 is human settlement with air quality included in the WHO database by year of release. So you realize that it's been increasing year in, year out. But that increment, what is the contribution of Africa to this increment? Is very, very small, as you can see from table 1. So not only do we have the problems here, but we are also bereft of data. So that is something I want you to keep at the back of your mind as we proceed. Then this was also a recent report that was produced, and this is countries in high and medium high opportunity band representing locations where there are greatest opportunity to fill PM2.5 data gaps. So there are data gaps, PM2.5 data gaps across the world. And what this report was trying to look at regions where there are opportunities to fill these data gaps. And Africa has the greatest opportunities, as you can see from the map. But how do we leverage these opportunities? And that is something that we'll also come to as the lecture progresses. I always like to throw this in my presentations on air pollution, even though it's an old report, but it's still very relevant each day that I give this lecture. And this was a report that was produced by Rana Roy for OECD. The reason why I bring this here in that is just to showcase that air pollution is killing more people than the conditions or the problems that our politicians are paying particular attention to. You cannot fault them. Unsafe water. There's a lot of programs, there's a lot of investment in unsafe water. More nutrition, a lot of investment, a lot of programs on more nutrition. Same with unsafe sanitation. And you have bilateral organizations, multilateral organizations investing in these problems. But why are they not investing in air pollution? When air pollution clearly from this report and also from the global burden of diseases studies, which showcases that now air pollution is the second leading risk factor for death. Why are we not investing in it? The simple answer is lack of data. We don't have the data to show the levels of air pollution, but importantly, we also don't have the epidemiological data that suggests that air pollution is killing people, that suggests that air pollution is the driver behind the rising incidence of cardiovascular diseases that we are seeing on the continent. So that is the answer if you want it. So I indicated that I have issues with the maps that are generated. And it's because we have limited data on the continent. These maps are generated from satellite-derived PM2.5. In the interest of time, I just want to highlight two very important things. You know, what is happening is that the satellites, there is a 1 hour overpass. So just the 1 hour overpass, that is the measurement that we get. So we are not getting the whole compendium of measurement throughout the day, which a ground monitoring data will give you. The other issue is that the AODs represent the whole atmospheric column. Whereas if you have ground monitoring installation, that will give you breathing levels. But I must indicate that in spite of these shortcomings, satellite data also confers some benefit. And the benefit is the wide spatial coverage. And for us who are epidemiologists, we need to have very fine measurement. We need to have exposures for each individual person. So if you have a very wide spatial coverage, then it's very important for exposure assessment so that we can have very accurate health effect estimate. But notwithstanding, these two limitations that I highlighted in terms of it taking care of the whole atmospheric column rather than we needing the breathing zone, and then also because of what did I say that sorry, because of the 1 hour overpass. That is the more reason why we need a ground installation, the ground monitoring installation, and not continue to rely on the satellite estimate. So this is the 1 hour overpass. There are also issues with diurnal variability at locations, which, you know, the satellite is only able to take measurement on clear days. So when you have cloudiness masking the sky, then of course the retrieval abilities is also compromised. So what you realize is that in recent time, there's been a boom in low-cost sensors. And I must say, I have a monitoring network in Accra and also across Ghana where we are leveraging these low-cost sensors. So the reference grade monitors are very, very expensive, in a region of about $40,000, $50,000, $60,000. And this is the reason why most African countries cannot afford. So once they cannot afford, then there are problems with data availability. So you will realize that research groups, individual citizens are now procuring these low-cost sensors and using it to bridge the air pollution data gap in countries. So it's very important that we leverage these low-cost sensors, because I also talked about the fact that, you know, government is not investing in air quality. This is because they lack data. And when you look at the global burden of disease studies that is produced, it used to be yearly, now 2 years or 5 years or whatever, there is something that they developed that they call the integrated exposure response functions. And that is based on risk estimate from each region of the world. And because Africa will lack data, there are very limited risk estimates that goes into the development of these exposure response functions. So the question I give to you is that, what is the applicability of this global burden of disease estimates or this integrated exposure response functions to Africa, where we have very limited estimates going in there? And the bulk of the estimates that are in there are estimates from North America and then also Western Europe. So this is the question: how reliable are the global burden of diseases for sub-Saharan Africa? And the issues are here. The estimate of the burden of disease attributable to air pollution are based on extrapolations of results of EPI studies from locations which are very low ambient PM 2.5 level. And in North America and Europe, the levels are very, very low compared to the toxic mixture of cocktails and high levels of pollutants that we see in our environment here. And this is because we have not conducted epidemiological studies. There are very, very limited epidemiological studies that emanate from Africa on air pollution health effect. And this is also a huge evidence gap that we need to bridge. The other issue is that the relative contribution of specific sources of air pollution differ from those in North America and Europe. And that is the more reason why I conclude by saying that the integrated exposure response functions have very limited application to sub-Saharan Africa. And this study here in the figure tells us straight about it. If you look at this exposure response function from the global burden of disease study, you see where the line is. And there was a study that was conducted which was try to generate a relative risk curve for all-cause mortality for respiratory infections. And if you look at where the curve is, then you can plus, you look at the confidence interval, then you can see that there is some difference between what the global burden of disease studies is projecting from Africa and what this study actually derived based on data that they collected in Africa. So these are some of the strengths of the low-cost census and the reason why we are advocating for them to be deployed at scale. I mean, for epidemiologists, we are able to get very high spatiotemporal resolution measurement, and that is very good for exposure assessments. But that will require that we deploy these low-cost sensors at scale to give us something we call ubiquitous monitoring, and it enables better quantification of the exposures. And exposure assessment is the main shortcomings of air pollution epidemiological studies. So if we are able to get data at a very high spatiotemporal resolutions, then of course. And the good thing about low-cost sensors is that now you can co-locate with a reference grade monitor and you can develop correction factors. So even though there are some limitations in terms of data quality issues with low-cost sensors, the correction factors can help us to correct for the low-cost sensor measurement. So there shouldn't be any fuss about this going forward. So we also saw this earlier on. So very early on, I tried to identify the prospects of the proliferation of low-cost sensors for epidemiological research in sub-Saharan Africa. And this paper, in my estimation, is a good read, and I will urge you to pull it up and take a look at it. So we are getting into the health issues. So again, in the recent Global Air Report, air pollution now has overtaken diet and tobacco as the second risk factor for death. And if you look at the havoc that poor diet and nutrition causes to our health, if you look at the havoc that tobacco causes to our health, and if you now have ambient air pollution overtaking them, then it means air pollution is a serious issue that we need to tackle head on. And here you can see the proportions of respiratory infections, ischemic heart diseases, and COPD that is attributable to air pollution exposure. And as usual, the burden of disease is very high in Africa and in sub-Saharan Africa and South Asia, where the air pollution levels are very, very high. Importantly, in this report, you also realize that children are the most vulnerable group. So about 700,000 plus of children under 5 deaths was attributable to air pollution in 2021. And again, the largest burden was seen in Africa and Asia. So it's just the same story. WHO produces this, and then we know that every year 7 million deaths are due to exposure to outdoor and household air pollution. And in Africa, 1 million deaths every year is attributable to air pollution exposure. So in many cities of Africa, you can reflect with these. And these are the major sources of air pollution in Africa. The boom of Okada, as it's called in Nigeria. In Uganda, is called border. And you also have this rickety public transport. In Accra, we call it trotro. They have several names in several African countries. These are very polluting fleets. You have these tricycles that is also helping in a way to address waste management challenges on our continent, but they are also a very polluting fleet. West Africa is notorious for e-waste recycling. Ghana and Nigeria, Lagos has one of the biggest e-waste dump sites. And this is what the young guys are doing, burning them. And in as much as they are polluting the skies, they are also exposed to a dangerous cocktail of air pollutant that is also causing havoc to their health. In many neighborhoods in Africa, you see unpaved roads, and these are bigger particles. Street cooking. In Africa, we love our street food. And this is grilling that is going on. And usually in the evenings, that is when this thing happens more often. So you see a lot of pollution in the neighborhoods. Fish smoking in the coastal areas. You have open burning of waste because we are always inundated by waste. We don't have waste trucks coming in on time to pick the waste. So what do households have to do? They have to set fire to the waste. Okay, so with this background on air pollution, what is also the climate change impact on air quality? So air pollution and climate change are two sides of the same coin. They are deeply interconnected, with each exacerbating the effect of other. The chemical component or constituents that lead to degraded air quality are usually co-emitted with greenhouse gases. So for example, PM 2.5, when you burn charcoal and wood in your household, you are not only releasing PM 2.5, you are also releasing black carbon. And black carbon is a short-lived climate pollutant. So generally or overall, climate change worsens air quality by changing the atmospheric ventilation and dilution. Also precipitation and other removal processes, and also the atmospheric chemistry. So if you have drier or hotter conditions, that can lead to high air pollution in general, particularly high ozone, by increasing the rate of photochemical production. So in Africa, as we are going to experience more intense heat waves caused by climate change, it will lead to more wildfires. And when there are more wildfires, it's going to increase emissions of greenhouse gases and also particulate matter. So that is how climate change will exacerbate air pollution or degrade air pollution on the continent. So this interconnection between air pollution and greenhouse gas emissions means that interventions to address one will generally cause a change in the other. And that is the reason why climate action plans usually also addresses air pollution in the space, because it takes care of both. So for example, if we reduce combustion of fossil fuels, which we depend on for energy, transport, and cooking, we are not only going to reduce greenhouse gases like carbon monoxide, but we are also going to reduce nitrous oxide and also PM emissions, which are classic or two of the criteria air pollutant. And then also importantly, when you reduce nitrous oxide, it will also help to restrict the formation of secondary pollutants, such as ozone and nitrate aerosols. So this is a figure on climate and air quality interactions and their direct and indirect effects on health. So you realize that in the center, climate sits there. And climate interacts with health. It also interacts with our ecosystem. It also has an effect on secondary pollutant, as I elaborated on nitrous oxide. It also has an effect on the primary pollutant and the health effects. And then climate also impacts food security, crop yield, etc. Air pollution also impacts crop yield in a way. So you can see the interrelationship in this figure. So these are the classic health effects of air pollution exposure. And what you see in this chart is that air pollution virtually affects every organ and system in the body, including very weird outcomes like mental health. And there is ample epidemiological evidence, and some of them are causal evidence that has linked air pollution to all these outcomes. And therefore, it becomes very imperative that we tackle the air pollution problems across the globe. We can also distinguish the health effect into short-term health effect and then also long-term health effect. So the short-term health effect are exacerbation of asthma, cough, wheezing, and shortness of breath. And then the long-term effect are the stroke, the lung cancer, the respiratory conditions, and the cardiovascular diseases. And just to reiterate the point that there is causal evidence in support of all these health outcomes. Children are the most vulnerable groups. And there is a reason why. Their lungs are still developing. Their immune system are underdeveloped. So they are susceptible to bronchitis, asthma attacks, risk of lung cancer, pneumonia, and chronic coughing. So these are some of the impact of air pollution on children's health. Air pollution exposure among children has been linked with undernutrition, especially stunting. It has been linked with asthma, development of asthma, exacerbation of asthma, impaired lung function. It has been linked with behavioral disorders, IQ deficit. It has been linked with birth outcomes, low birth weight, premature birth, infant mortality. And some of these things, we have quantified them in our own data in Ghana here. Air pollution has been linked with childhood cancers. And I must indicate that if air pollution leads to, if air pollution causes maternal exposure to air pollution leads to low birth weight or premature death, based on the origins of disease in utero and the Baker hypothesis, this child is susceptible to becoming stunted. And then also it can lead to chronic diseases in their adulthood. So it's imperative that we mitigate exposure among pregnant women and also among neonates so that in their adulthood, they are not also at risk of these cardiovascular diseases. This is another slide on climate change, air pollution, and the health nexus. So what you see down there in the down circle is the cumulative health impact. And then you see a number of things that exacerbate the climate problem. These same things also leads to air pollution, increases air pollution levels, like the energy and transport, like industry, like agriculture. And agriculture here, I want to highlight the fact that we who eat meat, whenever these cows and cattle are burping, they release methane. And methane is also a short-lived climate pollutant. And also the fertilizers, ammonia fertilizers that we are using also is some of the pollutant, air pollutants that we are seeing. You have cooking and you have eating, which is also using wood and charcoal. And that is also providing, generating black carbon. Black carbon is a short-lived climate pollutant. It's also emitting PM, which is one of the criteria pollutant. And you see how they are interrelated with the health effects, as you see in the down circle. So one of the learning outcomes is to identify the vulnerable population. So these are the vulnerable population. You have the elderly, you have children under 5, as I've indicated, you have pregnant women because their physiological status is compromised, and then you have people that are suffering from respiratory diseases, and then also cardiovascular diseases. But also, to add to this, if you live in a community with very poor air quality, then you are also part of the vulnerable group. If you live close to a major road, then you are also part of the vulnerable group. But then let me also highlight that in Africa, and this lecture is based on Africa, there are certain groups that are more vulnerable. And this, one of the groups you see here are street vendors. Street vendors, they dominate the urban landscape of sub-Saharan African countries. They're selling in the street to make a living. These are migrants from rural areas in search of better livelihood. They are one of the main drivers of the informal economy, and they are exposed to a dangerous high cocktail mixture of air pollutants with consequences for their health. E-waste recyclers and also waste pickers, this is something that is also synonymous with African settings. Again, the context is the same. These are migrants. They are in search of better livelihood, and this is what they have to do for a living, polluting the airspace, and also their exposure leads to consequences for their health. This is also, that is very common in African cities. You go to North America and Europe, you will hardly see a policeman standing in the middle of the road directing traffic. But here you see them. And the reasons are simple. Our traffic lights are always not working. We have serious driver indiscipline on our roads. Drivers are parking on the shoulders of the road. They are stopping in the middle of the road to pick passengers. And this is what has necessitated police officers from being in the middle of the road to do their job. And as they do this, they are exposed to high levels of air pollution. So what are the solutions? The solutions are for us to invest in energy efficient power generations. If you go to East Africa, the geothermal potential is very huge. But are we tapping them? We have a lot of sunshine on the African continent. Why are we not leveraging solar power? And we are still relying on fossil fuel and coal to power our, to fuel our electricity needs. We need to also invest in active travel. We need to cycle and walk to work. We need to abandon our cars at home and cycle and walk. And if we invest in active travel, it also has public health co-benefits. Because if you are cycling and walking to work, you are increasing your physical activity level. And once you are increasing your physical activity levels, that has implications for your cardiovascular health. We need to transition to clean energy fuels. That means we need to move away from using charcoal and wood for cooking and rather embrace LPG and maybe electricity, which is expensive. But we need to be able to make sure that LPG, liquefied petroleum gas, is easily accessible to the population so that we can forgo wood and charcoal and use that and reduce air pollution in the space. I must indicate that reliance on LPG will not address the climate problem though, because that is also fossil fuel. We can also use public transport, but the problem we find ourselves in Africa is that, one, the buses are rickety. The buses are not regular, they are not on time. I mean, the World Bank funded bus rapid transit systems in several African countries. What is the story about them today? Most of them are dysfunctional, and that is the problem. So we need to revisit this bus rapid transit system so that we can get people to abandon their private vehicles, join a public bus, which is an electric bus, and then we can mitigate air pollution in our space. So I talked about the fact that we need data. If you want the politician to invest in air quality, then of course they need to have data. And I talked about the fact that there are groups on the continent that are trying to make air quality data available. So this is one of the projects that I lead in Accra, which is called Breathe Accra, and is funded by Clean Air Fund, and is part of the Breathe Cities initiative. And we are trying to provide real-time air quality data in the Accra landscape for protection of public health. With this project, we have been able to deploy over 65 plus air quality, low-cost air quality sensors in Accra, and is generating real-time air quality data. The mother project is the Ghana Urban Air Quality Project, which anchors the Breathe Accra. And this one is also helping us to deploy sensors in other metropolitan areas of Ghana, because Ghana is not only Accra. Through the project, we have been able to identify air pollution hotspots, and we are working with the district assemblies to put in a mitigation strategy. So on the map on my left, you will see the air pollution hotspots that we have identified. On my right is one of the mitigation measures. So one of the intervention strategies is for us to develop a sensitization manual, which environmental health officers in the district are using to stimulate behavioral changes. Because let's face it, the air pollution problem at the heart of it is behavior. So if we are able to change behavior, then of course, we'll be able to mitigate air pollution in our space. And it's very difficult for you to go to a district assembly and tell them to invest in an electric bus. They possibly don't have the funds. But of course, if we can put in measures that will change behavior, then of course, we are making a headway. And this manual is available on both websites, which you can download and also use in your sensitization activities on air pollution. Then also, these are measures that we can use to protect ourselves against air pollution, both in the outdoor environment and also at home. We can wear nose masks. And when COVID-19 was with us, it wasn't difficult for us to wear nose masks. So it shouldn't be a problem for us to also wear nose masks when we find ourselves in a very polluted area. We need to avoid polluted spaces. We need to avoid jogging and cycling, especially when air pollution levels are high. And then also we need to check the air quality levels before we step out. And that is the more reason why initiatives like the Breathe Accra and the Ghana Air Quality Project has enabled data to be available in the Ghana space to advise individuals and the citizenry on the air pollution levels for them to advise themselves. We need to avoid burning garbage at home. We need to avoid using biomass fuels and rather transition to clean cooking fuels. We can use air purifiers. We can improve ventilation at home, and then we can keep some plants that will purify the air at home for us. And then also, I must also indicate that the air pollutants are free radicals. So we can improve our nutrition to mop up these free radicals when they attack our systems. So we should be aiming to consume foods that are very rich in antioxidants, like vitamin E, like selenium, and also vitamin C. Then we also increase our intake of vitamin D-rich foods, which are anti-inflammatory, and then omega-3. And we are undertaking an intervention study in Accra, where we are providing street vendors. We have two groups of street vendors where we are providing one group with antioxidant-rich foods and the control. And we want to compare and see how increased intake of antioxidant-rich vitamins and food will help to mitigate the air pollution health effect among this vulnerable population. So the question here is that, do I have to start picking and choosing what I want to eat? No. The plate down there is what we call a healthy eating plate. So in Africa, you realize that about half of this plate is our carbohydrates. That narrative will have to change, where half of this plate is vegetables and fruits. Then you have your proteins, then you have your whole grains. So if your plate is like this on a daily basis, and you are exposed to air pollution, of course, it's going to help to cut back on the health risk. And there is emerging literature that supports good nutrition and attenuation of air pollution health effects. So these are some of the health co-benefits of any climate action plans. So, of course, when we mitigate air pollution in various sectors like housing, transportation, and energy, there is substantial health gains and reduced health risk. And there are tools to assess, plan, and finance these interventions. These tools can also help us to track the health indicators. And the tools that you can use to quantify the benefit of air pollution or health impact assessment are EQ Plus, which WHO uses, was developed by the WHO. You have green space tools, you have bar household air pollution to establish the benefit of actions to reduce household air pollution. You also have tools for sustainable transport and then also heat. I think I've talked about this somewhere in the slide, so I might skip these ones. So in conclusion, in sub-Saharan Africa, in the short to medium term, low-cost sensors should be leveraged over prohibitively expensive regulatory and reference-grade instrumentation. In the long term, investment in regulatory instrumentation, no matter how limited they will be, is recommended for periodically calibrating sensor networks and developing correction factors. When we are able to develop the correction factors, then it will help us to address the data quality issues and inspire public confidence in the policies and regulations and research findings that can emanate from the air pollution data. Thank you.
Thank you so much, Kofi, for that presentation and for enlightening us. I know you will be dropping off in a short while, and hopefully you can find time to address, a few of the questions from the participants before we go to the next presenter. One participant is asking, what is PM 2.5? I hope, let me take the first 4 questions, and then you can probably respond to that. What is PM 2.5? And how does it affect air quality? One of the question that has been presented by a participant. And another question that we have is that does dust include, part of air pollution? Would it be fair to filter out dust and measure other pollutants as well? We have anthropogenic pollutants, we have biomass pollutants, and has that been done before, where we have, disintegrated different kind of pollutants in one way or another? The third question is on cooking gas for cooking and television in our homes. What advice can you give for us to be able to reduce the risk of exposure to CO2 emission? And last but not least for now, is there evidence, a conclusive evidence and data that supports the effect of air pollution on adverse pregnancy outcomes, such as low birth weight, premature birth, and stillbirth? Kofi, do you want to take on the floor?
Yeah. So the first question is, what is PM 2.5? So PM 2.5 are particles. So particles, including dust particles. But then they come in diameters. So the smallest one of the smallest one is particles less than 2.5 microgram per meter cube in aero diameter. You also have ultra-fine particles, which are less than 1. And they are grouped because of their consequences on health. So if you have very small particles like PM2.5, they can be very dangerous to your health. I don't have any hair, but if I'm able to pull a strand of hair, the PM2.5 is much, much smaller than a strand of hair. And so if you inhale this, it's able to penetrate very deep into your cardiovascular system. And that is the reason why it's able to cause havoc to you. WHO has 6 criteria pollutants, and the PM2.5 is one of them, together with carbon monoxide, nitrous oxide, sulfur dioxide. What is it? I'm missing 1 or 2. Yeah. So that is the PM2.5 for you. And it's the pollutant that the epidemiologists focus on mostly because of what I enumerated, their devastating effect on health. Can we filter dust? You know, in Africa, one of the sources of air pollution is dust pollution because of the unpaved roads. But the good news here is that these are bigger particles. They are PM10. So they are bigger particles. So compared to the PM2.5, they are not as hazardous. But still, we need to be able to control that. Why do we want to filter the dust particles? I'm not an atmospheric scientist, and what approaches are available? What I would advise is that we need to mobilize ourselves so that we'll continue to water the dusty roads to reduce the dust pollution in our neighborhood. Gas cooking. You know, if we cook with gas, that is also fossil fuel. I mean, and as I indicated, it doesn't help us to address the climate problem, but it helps us to address the air pollution problem. And once we address the air pollution problem, then it helps us to cut back on the health risk from air pollution exposure. And I will tie that to pregnancy and the empirical evidence on that. In Africa, our wives, our sisters, our mothers, they are always in the kitchen cooking for us delicious meals. And some of these delicious meals cannot be cooked on gas. It has to be cooked on the traditional cook stove so that we can have the taste. It's culture. It's become part of us. The problem is that we don't save these women from these cooking activities when they are pregnant. So when they are pregnant, they will still have to cook till they deliver. They are exposed to high levels of air pollution. And in fact, it affects the fetal development and leads to these adverse birth outcomes like preterm birth, like stillbirth, like low birth weight. And there is a lot of empirical evidence. There is causal evidence. In one of the papers that we published, and it was the mainstay of my PhD in 2014, we were able to provide evidence that exposure to air pollution during pregnancy causes the spectrum of adverse health outcomes. So advice here is that when women are pregnant, we need to get them to come off the kitchen, completely. But if they have to cook, then that is the time they have to transition from the dirty cooking fuels to using the LPG and then also the gas. Yeah.
Thank you so much, Kofi. Just because of time, I will just add, 3 more questions for you for now. What is our pollution rate as compared to, especially air pollution rate as compared to other continents, Europe, America, Asia? What is the pollution rate? What is our contribution? The second question that this participant is asking, in all the presentations that we've had so far, Africa is still having a data problem. How can this problem be solved? Is there a way, this data problem can be solved maybe at individual level, community level, or even the national level. That's very important. And Kevin Adongo is also asking that every time you are going out of the house, it is important to check the air pollution levels before leaving the house. How feasible is that? Don't you think that would be costly? Can you take all that coffee before we go to the next session altogether?
Okay. So I'll take the last one first. It's very, very simple. It's not difficult. Now, CNN provides air quality updates. So even if you don't have access to a project like our project, or you live in a country where your environmental protection agency is not providing air quality updates, watch CNN and you might be able to get the air quality update for your city. But besides, now in many African cities, there are projects like ours. The Breathe Accra is under a Breathe City initiative. It's being rolled out to Nairobi. It's being rolled out to Joburg, Kampala, Uganda. They have Echo Project. So now you have a number of projects that are generating air quality data in real time. And there are apps. We are in the process of developing an app for Android and also for iPhone, Apple Store. So you can download some of these apps on your phone. So when you want to step out, and importantly, my advice here is that if you suffer from asthma or you suffer from some serious cardiovascular diseases, it's important that you check the air pollution levels at wherever you are going. So it's not difficult. Just visit our website, breatheaccra.org or GhanaAQ.org. I'll put it in the chat box. And then you will realize that it's not a difficult proposition to do. I'll take the next one. How do we solve the data problems? All the lectures that you have been in so far, you realize that Africa is bereft of data, not only air pollution data, climate data, even health data, because we have problems with health reporting. So we are not only talking about exposure data, we are also talking about issues with outcomes data. The question here is that how do we solve these data, or how do we bridge these data gaps? Bridging these data gaps requires us as citizens to also step in the hole of regulatory agencies like we are doing in Accra, like Echo Project in Uganda is doing in Uganda. So you don't expect, yes, we expect government to provide reference grade monitors, but where they cannot provide, we as citizens can also, through research projects, develop this monitoring network and generate some data to bridge the data gap. We need to share data. That is one of the problems we have as a continent. We don't share data. There are researchers collecting data for climate research, for air pollution research, for this, and when they finish, they are reluctant to share the data. So we need to deposit these data in data repositories. Once we have them in data repositories, everybody can get access to this data and be able to make decisions. The other problem we have as academics, and here is not only as Africans, we publish to become professors. Yes, it's good to become a professor. But when we publish, we need to share our findings with the policy decision makers. That publication is also data. So when we share this with the policy decision makers, at least they have access to data for informed decision making. So that is how we can bridge the data gap on the continent. Finally, how do air pollution levels compare to levels in Europe? We are bad. We are very, very, very bad. The air pollution situation is worsening on the continent on a daily basis. But the question here is that, do we know the extent of pollution? Do we know the level? The answer is no. The answer is no, because of the lack of instrumentation to monitor air quality. But if you look at the activities that are happening in Lagos, if you look at the activities that are happening in Accra, in Nairobi, in Johannesburg, you don't need somebody or a reference instrumentation to come and tell you that air pollution levels are worsening. I projected some of the main drivers of air pollution on the continent. You saw that rickety public transport. You saw the, what is it? The tricycles. You saw the street cooking. Where do you see street cooking, kebab being cooked in Europe and North America? It's only in South Asia, in Africa that you see that. You know, where do you see e-waste burning in North America and Europe? It's only in West Africa, Accra and Lagos. So where do you see waste burning, open burning of garbage in Europe and North America? It's only in Africa and South Asia. So we don't need the reference instrumentation to tell us levels are high before we start acting. We need to start acting now to drive the air pollution levels down. Thank you.
Thank you so much, Kofi, for that insightful presentation and for the responses you've given. We would have loved to go on and on, however, time might not be on our side. And so we would want to thank you so much. And up to this point, I would want to invite the second presenter, that is Zeza, who will be presenting a case study. And Daniele, are you taking this up now?
Hi, everyone. I'm Aziza Rangunwala, Africa Regional Coordinator for Global Green and Healthy Hospitals, based at Groundwork, Africa Partner for Healthcare Without Harm. I will be presenting on Groundwork's deadly air case for our degraded air quality session. The Highveld priority area is a major coal region and is also one of the worst air pollution hotspots in the world. It spans 2 provinces in South Africa, Mpumalanga and part of Gauteng, which is our economic hub. It is also home to socioeconomically marginalized communities. Coal plants and oil refineries are the major sources of pollution in the region. The electric public utility owns and operates most of the coal plants in the region, and multiple reports and documents incriminate them as one of the key polluters in the region. A 2019 independent report found Highveld pollution from 12 coal plants, a coal to liquid plant, and an oil refinery massively exceeds World Health Organization guidelines. South Africa's economy is based on an energy paradigm called the minerals energy complex. This has led it to being one of the most energy and carbon intensive countries in the world. Now, we are guided by legislation, and the government promised to clean up air pollution on the Highveld by declaring it a priority area under the Air Quality Act. In November 2007, the Highveld area was declared a Highveld priority area following demands by civil society for an intervention. The then Minister of Environmental Affairs declared 31,000 square kilometers of the heavily polluted Mpumalanga Highveld, then home to about 3.6 million people, a priority area in terms of the National Environmental Management Air Quality Act of 2004. We are also guided by the Constitution of the Republic of South Africa. And the constitutional rights that are included are Section 10, which is the right to human dignity. Section 11 refers to our right to life. Section 24, the right to an environment that is not harmful to your health or well-being. And then lastly, also Section 28, which speaks about the fundamental rights of the child, which we know falls under the vulnerable population. Now, I would like to elaborate more on Section 24. Section 24 that speaks about everyone has the right to an environment that is not harmful to their health or well-being, and also to have the environment protected for the benefit of present and future generations through reasonable legislative and other measures that prevent pollution and ecological degradation, promote conservation, and secure ecologically sustainable development and the use of natural resources while promoting justifiable economic and social development. We also take into account the WHO Global Air Quality Guidelines. So the case, which is referred to as the deadly air case, was brought against the government by two environmental justice groups, Groundwork and Vukani Environmental Justice Movement in Action. These groups were represented by the Center for Environmental Rights. The case was filed in the court in June 2019 on the grounds that government has violated the constitutional right to a healthy environment for the people living and working in the Highveld priority area. By failing to improve the deadly levels of air pollution in the region, and they requested the court to declare that the poor ambient air quality in the Highveld priority area constitutes a violation of the right to an environment not harmful to health or well-being, and to order the government to promulgate regulations to enforce the Highveld Air Quality Management Plan. The groups took to the courts as a last resort. There's been years of evidence gathering, campaigning, and engaging with government and policymakers to take note of the situation and bring in mitigative action. The Coalition of Center of Environmental Rights, Groundwork, Earthlife Africa, called Life After Coal, published various reports and wrote many letters to various ministers and agencies who maintained that there were no compelling reasons for any additional action in the region. Fast forward to 2022. March 2022, a landmark judgment in the case pertaining to air pollution that has far-reaching consequences for human rights in South Africa was secured. The High Court of South Africa recognized the poor air quality in South Africa's Highveld region as a breach of the residents' constitutional right. So the court also ruled that the minister has a legal duty in terms of Section 20 of the National Environmental Management Air Quality Act to prescribe regulations necessary to maintain air quality standards, essentially to clean up the dirty air in the region. The groups also commissioned studies on the Highveld region, studies on the health impacts of air pollution, especially from coal in the region, from several researchers and medical professionals. It is commonly accepted that the air pollution in the Highveld priority area is responsible for premature deaths, decreased lung function, deterioration of the lungs and heart, and the development of diseases such as asthma, emphysema, bronchitis, tuberculosis, and cancer. It is also acknowledged that children and the elderly, especially with existing conditions such as asthma, are particularly vulnerable to the high concentrations of air pollution in the priority area. So in 2017, a study revealed that over 2,000 deaths per year were attributable to coal-related air pollution, and that more than 9,500 cases of bronchitis among children aged 6 to 12 were also found. In another significant move, in November 2020, the United Nations Special Rapporteur on Human Rights and the Environment, Prof. David Boyd, was admitted as an amicus curiae, friend of the court, in the case by the High Court. Professor Boyd was represented by public interest law organization lawyers for human rights. Now, his submissions focused on the relationship between a healthy environment and the protection of other basic human rights, as well as the key steps a government should take to address air pollution. And one of the key steps that the government should address to address air pollution is by focusing on health. And that is why we need health planning for restorative justice in the Mpumalanga Highveld. This publication was commissioned by the Life After Coal Coalition and written by Dr. Geraldine Chironda from the University of KwaZulu-Natal. And this is important that we center health also in our just transition. And the Just Transition Open Agenda focuses on many aspects of the just transition away from coal, because we're looking at moving away from fossil fuels that are the major drivers of air pollution. Just transition also includes aspects of gender justice, a focus on youth, looking at transportation strategies and reimagining how transportation is imagined, reimagining jobs and what jobs look like in a just transition, where we're looking at a sustainable, greener and cleaner environment. Now, first of all, the judgment highlights the importance of compliance with air quality standards, as clean air is confirmed as a constitutional right. Any violation of the standard should result in penalties and legal action as a consequence of this ruling. Secondly, the court's finding that air quality is a constitutional right underscores the urgency with which government agencies need to act and protect the public from the ill effects of air pollution. Finally, this victory highlights the importance of systematic evidence gathering, the education of impacted communities and the general public, and the solidarity from medical and public health professionals in legal struggles. We also do a lot of health literacy workshops in the Highveld area, where communities can understand the impacts on their health and understand their rights for accessing health as well. Now, just as interesting to note is that full compliance with the minimum emission standards would reduce emissions of sulfur dioxide by 60%, PM2.5 by 50%, nitrous oxide by 20%, and mercury by 40%, compared with the scenario of no improvements in emission control technology. And this tells you how bad the air pollution is in the Highveld area. So thank you for listening today. The deadly air case is still ongoing. We are looking for response for health planning for restorative justice, but also looking at the air quality management plan for the Highveld and working towards collaborating with government to work on that as well. Thank you very much. Please feel free to contact me. Feel free to ask questions. We are always willing to engage further and collaborate on any other further research. Thank you for listening.
Thank you so much for the presentation by Azeza, and Dr. Mafoko will be here to answer the questions posted by the participants. One of the questions that the participant has asked is, we understand that we should be proactive actually in reducing pollution in our continent. But what about the African CDC? What about the African Union? Are they doing anything to impress on the Western countries so that they can be able to reduce, their pollution instead of forcing Africa, to sell them carbon credits? The second question, let me take 3 of them, then you can be able to respond. To what extent does a just transition fully encompass, intersecting factors such as race, age, gender, and other, kind of socioeconomic status in order to achieve a true climate justice for the vulnerable population facing multiple forms of discrimination? And another participant is also asking another question: how do we know specifically, the air pollution is only a risk factor for morbidity and mortality from other factors in healthcare? Dr. Mafoko, do you want to take those three questions?
Thank you, Patrick. I hope I'm audible. I will attempt
Yes,
some
you
of the
are.
questions. Yes, I think the idea of looking to the North and the global North to take responsibility, I think it's definitely an imperative that is ongoing when looking at the climate justice initiative, because we know that the global North is more responsible for the climate change we're experiencing currently. And so that definitely needs to be a discussion that needs to be had as far as the idea of carbon credits. But I do believe that we also need to look at home for interventions. Dr. Kofi indicated the lack of data, the lack of health outcomes data. And so we need to look at home in terms of ensuring that government does invest in air pollution. It's a gap that he indicated. And so looking at specifically the South African case, we're looking at a heavy reliance on fossil fuel-based energy generation. And we're looking at the non-compliance aspects. So, often when you point a finger, three fingers are pointing back at you. So in the South African case study, for example, we are looking at civil society that had to, become a collective and, take the government to court to demand their right to an environment that is not harmful to their health and well-being. And just to say, as much as the case is a victory, currently, just recently in August, the minister did publish the regulations just 2 days before the appeal case was heard. So the minister is appealing parts of the judgment, yet she has been found in breach of the people's constitutional right to an environment that is not harmful to their health. And so you see that back and forth of the people demanding their right and the state still dilly-dallying around ensuring that that right is granted to them. And so it's a David and Goliath case that is ongoing. And what we're seeing as far as compliance is concerned in South Africa is that major polluters are still being granted postponements to comply to the minimum emission standards. So that is an issue that is ongoing, and the state making what is illegal legal is a case for concern. As far as the just transition is concerned, for us in South Africa and civil society, the Life After Coal campaign, we've been bold in sort of declaring that the just transition is not just about energy. The just transition is about the Constitution. It's about ensuring that the rights of citizens or the people are observed, whether it's access to water, clean water, housing. The gender justice issue is also a concern. We're looking at adequate provision of health services that are fit for purpose for those that are exposed to various environmental injustices. So the just transition for us is really broad, and it speaks to compliance or people enjoying their constitutional rights. I think I'll leave it there, Patrick. Thank you.
Yeah, thank you so much. Another interesting question. Let me also give you another three that are very interesting here. Alfonso is asking one question definitely we are clear that environmental pollution impacts health disproportionately in sub-Saharan Africa. And it is also very clear that governments in Africa would easily fund, formulation of laws and implementation of laws that punishes LGBTIQ, but not on environmental pollution. How would you address this? The second one, somebody wants to understand a possibility to take the government to court in case they are not doing something to ensure environmental health is sustained. Is it possible? How possible is that? The third question for now, Mafoko, before we can be able to end, how can we effectively communicate the risks and impact of degraded air quality to the public while ensuring the accuracy and reliability of the data used? Back to you, Mafoko.
Thank you, Patrick. So as far as communicating the risks of air pollution, it's important to partner with public health professionals and other experts to really provide simplified way of engaging on these highly technical issues such as air pollution. And I think Dr. Kofi was trying to really simplify the ideas of, what is particulate matter. At Groundwork in South Africa, we host environmental health literacy workshops for communities that are impacted by air pollution. And the idea is to simplify the science around air pollution, but to also ensure that they are aware of the environmental exposures that they are impacted by. And by doing so, they're able to participate in national dialogues on air pollution. They're able to represent their issues as they have a lived experience of living in areas that are prone to air pollution. And so it's important for public health professionals, the health sector, to partner with communities that are affected in lending their voice, but more importantly, lending the evidence and the research and the science to really address the gaps in health outcomes data, but data in general. We also partner with organizations like the Clean Air Fund. Dr. Kofi mentioned them. They're also trying to advance the issue of data, the availability of data, but also the low-cost sensors that people are able to actually monitor the air quality in their locales daily, as suggested by Dr. Kofi, but also then be able to then have behavioral change and decide when to not go outside. And this can be a preventative aspect of that. And so that is how we are communicating the risks in a more simplified way. The idea of taking government to court really shouldn't be, one that is frowned upon. We have done it, and the courts have found in our favor. Often we celebrate our constitutions, and then we kind of turn around and sort of want somebody else to uphold those rights, but we consistently have to demand these rights. And by taking the government to court, we are simply demanding our constitutional rights. And it's often long, and you don't get answers instantly, but it is something that we have had to, as a last resort, to engage in, given the non-compliance, given the ignorance, and the idea of vulnerable communities still being exposed to air pollution. Thanks, Patrick.
Yeah, thank you so much, Dr. Mafoko, who stood in for Aziza in answering the questions. And I also want to thank everyone. I also thank Dr. Kofi, who presented earlier as well. Just as a reminder to you, kindly remember that you are supposed to actually get the link where you can share your post-session survey. So you can probably even scan with your phone or the camera on the camera. And you can also get the link of giving your feedback in the chat. Leading you today is Dr. Patrick Owili. Patrick Owili is a program manager at the African Population and Health Research Center. Otherwise, we want to thank you so much for attending this session, and we hope to see you again on Thursday. Thank you so much, and have a blessed morning, a blessed afternoon, and a blessed evening. See you again. Bye-bye.